a lot of people forget that health is a journey. You're not all of a sudden going to be a health expert where you have everything put together. None of us did. It took me years to get my health routine down. And so that's the way I approach it with that. Like, this is going to be a lifelong journey, because I don't want you to start doing something today that you're not going to be able to do 10 years from now. Because most people know what they need to change. They've thought about it. They just haven't set down an action plan.
You have to get the mindset straight in all of this. You have to understand where the patient's coming from, and what are they willing to do. I like to call it habit stacking. So it's doing one thing and then adding another and then adding another up to the point that you're able to do it. Welcome, everyone, to the Patient Advocacy Initiative podcast. I am so honored to have a board-certified internal medicine physician and pharmacist, which, that's my passion. As a lifelong learner, he continues to grow both personally, professionally, which has actually also led him to getting his MBA. And his focus is centered around patients. And the way he does this is through building relationships and building trust through a very comprehensive lifestyle medicine system. I also love to throw in fun facts. So some fun facts about our guest here today is that he's an avid reader. He's a video game enthusiast and a weightlifter in his spare time. But my favorite is that he loves keto donuts. So I'm going to have to get that recipe. But with that, please help me welcome Dr. Richard Harris to the Patient Advocacy Initiative podcast. So thank you for being here, Dr. Harris. Welcome.
Thank you for having me so much on the show. And please, we're colleagues. Call me Richard. I always tell people doctor is what I do. It's not who I am. And that's really my ethos, and how I approach life and business is just trying to do right by the people around me and be the best version of myself so I can pour into others.
Oh, I love that. You and I have very much a similar concept. So I'm the same way. Asha is what I go by. And I love that. It's just building up that trust. And I love everything that you stand for. So let's just dive in to your lifestyle medicine approach and how you help patients navigate their own health and well-being.
Yeah, people are coming around to the term lifestyle medicine. Probably before COVID, no one had really heard of it. They're like, lifestyle medicine, what is that? And I really look at COVID like a blessing and a curse. And I think the blessing was, in the first 6 months, I saw more lifestyle medicine research come out than I'd ever seen before. And the impact of lifestyle medicine on what the world was going through. And it was so timely. And for me, the journey into being a lifestyle medicine physician started when I was in undergrad. I was taking a biochemistry course, and part of the course assignment was diagram your family tree as far as diseases. And I said, okay. So I went to my parents, asked them about their parents, asked them about their medical conditions, because what 18-year-old talks to their parents about medical conditions, right? So I had no idea. And I'm looking at this list, and it's high blood pressure, cholesterol, diabetes, Alzheimer's, Parkinson's, colon cancer, substance abuse, anxiety, depression, PTSD. And I said, wait a minute, this is my family tree. These people have similar genetics than I do. So if I continue down the same route as them, I could end up with the same problems. How do I prevent that? And that's when I really started looking into preventative care, nutrition and exercise and stress management and sleep being the first things I started to look at. And then when I went through pharmacy school, we learn as pharmacists really what the effectiveness of medication is. And I'm not anti-medication. I'm use the right medication for the right person. And in pharmacy school, I'm looking at the literature and the data on some of these things. I'm like, wait a minute, some of these absolute risk reductions are really, really low for these conditions. And everybody's getting put on these things. And you're seeing people all the time on 8 medications have a heart attack, 8 medications have a stroke, 8 medications end up on dialysis. And that began to churn the wheels in my head saying, well, what else is missing, right? These people are on appropriate medical therapy from the guidelines. There's got to be something that's missing. And that's when I started looking at lifestyle. And that's when it dawned upon me, when you look at the statistics of the American lifestyle, it's very disease promoting. We're very sedentary. We're losing muscle mass at extraordinary rates. Our hormone levels, like testosterone levels since the 70s, just continue to drop in men. And you're looking at all of these things together and you're realizing that it's a lifestyle. We don't have a metformin deficiency. We don't have a insulin deficiency to begin with, right? It's what are we doing on a daily basis? Is it adding to your health or subtracting from your health? And that's when I really started to emphasize and dig into what are you doing every single day? And how do I optimize what you do, your habits daily to put you in the best place to succeed?
Oh gosh, I love everything. I could hear you talk all day long, Richard. Seriously. I love that you had the foresight and the intuition when you did that family tree to think it through and say, oh, wait, I have those genes too. I mean, I think about how many people don't look at the family history or even know, like you said, know what has gone on in the past. And so I think that's a really great place to start for a lot of people is just, hey, what are those genes telling you? What is your family history telling you? So I think that's really, really intuitive that you did that at such an early stage. I did the same thing. So that's my story. Your story is very similar to mine, especially when it comes to the diabetes and cardiovascular issues and things like that. So I think that's fantastic. So I want you to dig a little deeper into. So I love that you also said that you're not against medicine. Clearly, you're a physician. You're also a pharmacist. You know all about those things. I'm a pharmacist. So I've always taught the East meets West approach. My family's from India. So we were taught very natural, holistic methods, lifestyle medicine, essentially, growing up. And so I kind of meld the two together. And so I want to hear your approach to that when it comes to, that people are coming on multiple medications. That's kind of where we are as a society, I feel like, in our healthcare system. So what's your approach to that? And how do you handle patients that come to you in that kind of state?
Sure. So I break it into two overall buckets. You have the patient who comes to you with risk factors before they get on medication, and you have the patient that's on medication. And then I'll ask them straight up, number one, how often do you actually take all of your meds? And we know as pharmacists, adherence data is awful. We're talking in clinical trials, randomized controlled trials, that you're literally controlling for every single possible variable you can, where people are being monitored and getting follow-up that's far greater than follow-up that you would get in free living, meaning real world conditions. Your adherence is like 50% at the high end, right? Maybe 60% at the high end. Real world, we're probably talking about 30 to 40% adherence. And so I will talk to them like, what are you realistically doing? Like, really, tell me, be honest with me. How often are you taking these meds? What meds are you taking? And so then I'll be like, okay, so this is what you're taking. If you're not taking this other stuff, let's get rid of it for now. And then why are you taking these meds? What about these meds has you taking these with the frequency that you are? And then they'll tell me, well, I'm worried about cardiovascular disease, or I'm really trying to lower my A1C. So when a patient tells me that, now I know what lever I can push. So, okay, you're really worried about lowering your A1C. Do you take frequent walks throughout the day? No, I don't really walk. Do you track your steps? No, I don't track my steps. Well, did you know that getting 8,000 steps per day can cut your risk of dying from any medical cause by up to 50 to 60%, depending on your age range? They're like, what? Really? I'm like, yeah, it can. Even taking a 10-minute walk after you eat can dramatically lower your blood sugars. What? Really? Yeah. So, that's how I approach people on medication, find out what they're on and why they're taking it. And then I put a lever there on why they're taking the medication and what they can do lifestyle wise. And I'll give them a couple options and ask them, which one of these is the thing that you're most likely to do? And then start there. Because you start at one point, and what happens is when you start building up positive habits, they're like keystone habits. Someone starts walking, they feel better. They're like, wow, this is great. What else can I do? Well, how are you eating? Have you thought about changing around what you're eating and how that could impact your blood sugar? Yeah, I've been thinking about that. What should I do? Boom. Okay, now I can layer that. And you just start layering things together. A lot of people forget that health is a journey. You're not all of a sudden going to be a health expert where you have everything put together. None of us did. It took me years to get my health routine down. And so that's the way I approach it with that. Like, this is going to be a lifelong journey because I don't want you to start doing something today that you're not going to be able to do 10 years from now. And so that's how I approach someone who's on medication. Someone who has risk factors, I say, okay, you have risk factors. You're heading in this direction. Are you someone who wants to be on medication possibly for the rest of your life? Almost no one says, yes, that's, I want to be on medication for the rest of my life, right? They say, no. I say, okay, here's what you're at risk for. Do any of these things run in your family? Well, yeah, that runs in my family. Okay. Well, if you continue on the same path that you're on, there's a high likelihood that you'll get there. But if we change some things, we can probably prevent that, because most people don't realize that the lion's share of what's killing Americans is largely preventable. So that's the way I talk to them. And then it's the same process after that. Okay, what have you been thinking about doing? Because most people know what they need to change. They've thought about it. They just haven't set down an action plan. And that's what I do. I'm like, what have you thought about changing? What are you most likely to do? Well, I want to start exercising. Okay, cool. What type of exercising do you want to do? Well, I want to start off with strength training. Okay, great. Strength training is great and maintain your muscle mass. Best thing you can do for your brain, blah, 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 blah. How many hours per week can you realistically commit? Because we're really bad at examining realism. And so I tell them, what can you realistically do? Well, I can do 75 minutes a week. Perfect. Do 3 25-minute strength trainings. Doesn't have to be the gym. Could be kettlebells, could be home, could be beach body, could be Pilates, could be yoga, whatever you like. Start there. Start 3 25-minute sessions a week. And then once they start doing that, then I start building. You start layering things on top of that. So that's the way I approach it with people. And that's how we all end up being successful. Because I was reading another study a couple of weeks ago that showed that most people who are dramatically overweight have gone through a period of time where they've lost substantial amount of weight, but then they gain it back because what they did to get there wasn't sustainable. And so we have to really be honest with ourselves, work with somebody who can pull that out and kind of coach us through these things, and then start layering these behaviors. And over the period of a couple of years, you can end up being a completely transformed person.
I love everything that you just said. I'm like, ditto, ditto, ditto. I just want to, I mean, I echo everything that you just said. So would you say that the number one barrier that you kind of see when you talk to patients, whether they're on the medication side already taking or on the preventative side, is the idea that maybe they jump in too far too fast and then they end up giving up on what they're doing?
Yeah, I think that's part of it. I think the number one problem, and I was actually talking about this with another pharmacist, is when people come into a medical office, they're usually coming in at the end of the rope, right? They've had enough. They're fed up, and they're not in a position to be receptive to lifestyle medicine, because at that point, they just want something that's going to make them feel better today.
Mhm.
Because most people don't come see me when, things are kind of sort of okay. They're kind of concerned. They come in when it's really, really, really bad.
Rock
And I think
bottom kind
that's
of
rock
mentality.
bottom.
Yeah.
Yep.
Mhm.
They come in at rock bottom. And I think that's the issue, because I've given so much lifestyle medicine advice to so many people, and most of them don't take it. And I think that's because when I'm available to give them the advice is not when they're available to receive the advice.
Ooh, that's a
And
really great point.
yeah, and it kind of frustrated me for a while until I really started thinking about it. And I said, okay, well, the best I can do is maybe plant a seed. But you're right. Most people think that, and use a sports analogy, because I love sports analogies for just overall life. They think the first time they pick up a basketball, they're going to be Michael Jordan, or the first time they jump in a pool, they're going to be Michael Phelps. And I'm like, well, let's think about it. The first time Michael Jordan picked up a basketball, he probably sucked. The first time Michael Phelps jumped in a pool, he probably sucked too. And that's just the nature of things when you first begin. So we expect to be experts when we should be okay being beginners, and we shouldn't try to do everything at once.
Yeah.
Right? That's a great recipe to ensure that you fail. And some people, they fail once and they'll never try again. And that's why you have to go into the whole mindset aspect. If you're doing lifestyle medicine without helping people with their mindset and having them be okay with failure, I can't even tell you how many times I've failed. I've failed so many times over a wide spectrum of different things. And I'm like, okay, what did I learn? Let me try again. But you're completely right. That's why when I coach people, I tell them, let's pick the thing that you are most likely to do.
Yes.
And I usually start with one of the big three: sleep, nutrition, and exercise, right? Because those are the big three. Those three give you the most bang for your buck. Number four would be really meditation and mindfulness, but that's a tougher sell for most people because that's still new
Yep.
in the literature, in the media. Some people are coming around to it, but people know, everyone knows about the benefits of sleep, exercise, and eating better. They know it's not a hard sell because there's already a lot of awareness.
Mm-hmm. I think my number four, I love the meditation, mindfulness, stress relief. Those things are definitely high up on the list. The fourth one that I always see is hydration,
Mm-hmm.
is hydration status. Most people don't think about that when they're like, oh, I drink water, I drink, throughout the day, but they're not really, anticipating how much they're actually drinking and what that can do for their body from an energy standpoint, from so many different aspects. But
Mm-hmm.
I love that. And I think, what you said was really on point of, you have to get the mindset straight in all of this. You have to understand where the patient's coming from, and what are they willing to do. I like to call it habit stacking. So it's doing one thing and then adding another and then adding another up to the point that you're able to do it. You said people come to you at the end of the rope or rock bottom status, and I was in that place, so I'm fully on board with that, because sometimes you just don't know until you know that you're not feeling well. So I always encourage people, let's do things preventatively, preemptively. But when they're in that rock bottom status, how do you help them in that moment to be able to see that they need to do more from a preventative standpoint?
Yeah. Then you really think about, the trans-theoretical model of change, right? Because I'm going to assess that even when someone's at rock bottom, because some people are more willing to change at that position than others, right? And so if I put someone on a medication, I'm giving them a plan and a timeline to come off that medication. I'm saying these are the things that you can do to be able to come off this medication. It's like credit rehab, right? Your credit's bad. You go to an expert and they tell you these are the stepwise things that you can do to improve your credit. Let's work with me and I will improve your credit score over time. And it's the same thing when someone comes to me in this situation. Is I go through the same exercise. It may be shorter because I'll have to tell them about the medication and all of that type of thing. But I'm still going to try to plant that lifestyle seed and figure out what they can do to optimize it. The number one thing I do this with is with chronic pain. And I understand people's chronic pain. Most people don't know this, but I have been in daily pain every day of my life since I was about 9 years old. It started with IBS. Me and my mom ate the same dish. She got a really bad gut infection. She had to be hospitalized. I had a bad infection. I was younger, so I didn't have to be hospitalized. I was just able to chug Pedialyte and get through it. But after that, I started to have IBS. There are so many nights in high school and college that I would be in my room, almost crying, doubled over in pain. And I would suffer in silence. I didn't tell anybody. And then around 13, sciatica started. And I found out later, my grandfather had it, my dad had it. We have a really congenital tight L4, L5. And so I was in chronic back pain since I was 13 years old. And so for years, my pain was 8 or 9 out of 10 every single day. And I didn't want to take meds. And I would just dealt with the pain. And eventually my left leg went almost completely numb and didn't tell anybody, just dealt with it. And then I started to look into, once I started to learn more, I was like, there's got to be something besides medication for chronic pain. And then I learned mindfulness. Mindfulness can cut pain intensity and pain unpleasantness in some studies by half, right? Then I started looking at functional movement. Well, went to a chiropractor, learned some things about my body, never knew I had a scoliosis, never knew I had that tight L4, L5. So I started moving more intentionally. Then I started looking at nutrition. What was I eating? And I started eating more anti-inflammatories. I started eating more good fats. I started prioritizing protein to help my muscles recover. And so all of these things I started doing, I never went on medication for it. I got my back pain from a 9 out of 10 to now it's a 1, maybe 2 every day. Barely, most days it's barely noticeable. I'll have flares up. Everybody has flare ups of chronic conditions, right? But now I have a plan in place. Whenever I have a flare up, I've got a plan. I get flare ups of IBS every now and then. I have a flare up. I have a plan. I know how to treat it, and it goes back to where it lives now for my IBS. Most days I don't have symptoms. So, I tell people my story and dealing with chronic conditions and how I was able to utilize lifestyle medicine to dramatically improve these chronic conditions when docs told me I'd have to be on meds the rest of my life, or they told me in my 20s I'd have to have back surgery. And I was like, there's no way you're cutting on my back. I'm only 22 years old.
Yeah, there are other options. And I think, I mean, and I like, I mean, you explained it and I love your story. And I hate that you went through all of that, but your story is very powerful because it shows that it takes work and then it takes a plan it's not going to be the fix it now, fix it quick kind of method. So you can fix it in the moment, which is a band-aid approach, or you can have a plan in place. You have to work towards getting to the point of not being 8 to 9 to 10 in pain every day, to getting to that 1 to 2 every daily, because you're doing the right things along the way. And I think that's such a powerful story. So I appreciate you sharing that with us. And so I'm gonna give you just a couple minutes if there's anything else that you would like to add or share about your journey. And then I would love for you to tell our listeners / viewers how to get in touch with you, because I know you have so much to offer and you do so much for so many people. And I'd love for people to be able to access you. So please share any last minute words of wisdom and then how people can get in touch with you.
Yeah, absolutely. I think the first thing you have to realize is your health is not passive. Your health is active. You have to be an active participant in your health. Do not expect a doctor or a pharmacist or a nurse or somebody else to fix you if you're not willing to put in the work to fix yourself. That's the part that gets lost among social media and among influencers. They don't want to talk about personal responsibility because people don't want you to talk about personal responsibility. But you have to take responsibility for your health and your actions. The other final thing I want to talk about is we're rapidly coming on to an age of personalized and precision medicine where we can use genetics and advanced biomarker testing to really customize even exercise, nutrition, other types of plans for people, because we know when we look at studies, it's a macro. This is what's going to work for the largest range of people who look like a certain demographic, right? Cool. What if I don't look like any of the demographics in that study? What do I do in that case? Well, I can use that as a reference point, get the biomarkers, get the genetics, and say, okay, based upon that and the studies, you probably respond better to these medications. Or, you have these issues, so these are the foods that might be contributing to your problem. Let's try removing them one by one and seeing if things improve, right? So that's the age of medicine that we're going towards. I think pharmacists are going to be very instrumental. I think the care team of the future has a pharmacist on board. You'll walk in, you'll get the genetic swab, and the pharmacist will evaluate your medications and make recommendations based upon your subjective. Like if you're on a med and your genes say that's not the right med for you, but you're not having any problems, I'm probably not going to change that, right? But if you're having potential issues related to that medication or that medication is not working effectively, then I'm going to use the genetics to try and make a better fit. So that age is rapidly coming, and that's really awesome because it's going to be better for providers and better for the patients. And then finally, if you like listening to me ramble, I have a podcast called Strive for Great Health Podcast. It's available wherever you get your podcasts. I post a lot on Instagram and LinkedIn. You can find me on LinkedIn under Dr. Richard Harris. And then on Instagram, Dr. Harris, MD. And I mainly post about studies I read and give a quick spin on those studies and how you can apply what that study says to your life.
Oh, amazing stuff. Yeah, he has some fantastic pearls of wisdom anytime I listen to him, and the studies. And I love that it's evidence-based and you're showing what that is, and talking a little bit further about the precision medicine. and the healthcare team. I love that you said that you need to have a healthcare team put together for you in the patient advocacy world, because for you to advocate for yourself, you need the right people in place to help you do that. So thank you so much. I want to end by thanking you, Richard, for being here. I will have all of the ways to contact Dr. Richard Harris in our notes, and please feel free to reach out to him with questions. He's an incredible guy. So I look forward to talking with you further down the road, and I appreciate you being here. Thank you so much.
Thank you for having me. Listeners, have a blessed day.